Hello, everyone. My name is Bisan, and here you are the Hair Wire with us today. And we have Jerry, who's going to talk to us about why do you need an assessment for your hair.
Hi, everyone. Thank you for joining us at the Hairwire. Yes, I'm Carrie Jarrett. Yeah, both of us are trained trichologists. And one thing I hear about all the time is I have alopecia. But what type of alopecia do you have? What scalp condition do you have? Well, as trichologists, we're trained to help decipher the type of alopecia you have because, quite honest, it's not a one size fits all. And if you are treating a type of alopecia or a scalp condition or a hair loss condition that isn't the correct treatment for what you need, you can actually make problems worse. So it's very important for you to connected with somebody who is a trained trichologist, so that way you could really determine the type of hair loss you have for having optimal results for recovery. Now, in order to determine an appropriate hair loss or scalp condition treatment, it is necessary first to identify the specific cause or causes, because you can have more than one type of condition. And during your comprehensive trichological evaluation with a full case history, then we can specifically detail your health, your diet, your stress, genetics, lifestyle, your environmental influences of your hair and scalp, and we'll be able to discuss possible causes and suggest treatments or solutions that'll help improve your condition and appearance for you, specific to you. And a lot of times there's also a lot of treatment options that aren't affordable, or maybe you prefer a more holistic approach. So a lot of conditions do have more than one option. And so it's best for you to go to a trichologist who can weigh out the options that are best for you, for the type of hair loss, and for your needs financially, emotionally, and for greater results. Now, it's so important to get the correct assessment. Bisan, do you want to throw anything in there?
Yes, I want to say that I am so grateful for my hair because my hair will tell me exactly what's going on in my body. Really, like a lot of people don't realize that, but if we assess our hair properly, our hair is the uh, uh, first tissue or that will be affected by any chronic illness that has happened inside our bodies. So whenever your hair is brittle, or whenever you're having massive hair loss all of a sudden, or wherever you have hair loss that is just not normal, be be grateful that God is giving you a sign that something is going on in your body. And the perfect thing to do, or the first thing to do, is to go to a trichologist and have an assessment. Because if your hair will exactly tell you what kind of nutrient deficiencies you have. And not only now, for the past 3 months, because today I didn't take enough vitamin D3, for example, it's not going to affect me as bad as what happened over time for the past 3 months. This is exactly where your hair strand will, the mineral test of the hair strand will give you all these options. A lot of people don't know one simple hair strand will actually give you a lot of information, and for cheaper than blood tests and going through doctors and going through insurances and all this stuff. That's why I feel so grateful that I'm a trichologist, because I can, for me and for myself and for my family, I can immediately look at my husband's hair and it's like, okay, you are not eating properly lately. I can actually see it in your hair. It's so dry. You're not taking your fish oil. He's like, tell me, how did you know? It's like, I can actually see it. I can feel it. I can just look at your hair and know, because I know his hair a lot. I did a lot of examination for his scalp, and I saw his hair strands under a microscope. I am so familiar with the conditions he have, and that I can know what is going on in his body, or if he's stressed out. That's why, I mean, it's that our hair is the barometer of our health. That's exactly true. And as a trichologist, I am very grateful that I can see the stuff. And here we at the Hair Wire, we actually trying to just pass on this information to you and tell you it is very accessible. If you just go to a trichologist, a trained trichologist, to do an assessment, it can be cheaper, and it can save your life on the long run.
Absolutely. Now, you guys, trichologists, go find one if you're struggling with hair loss, hair thinning, split ends, breakage, dryness, dullness, limpness in your hair, lack of volume from what you've usually had, maybe an itchy, sensitive, flaky, or oily scalp. we will be able to help use that as a genetic biomarker to find out what's going on. Your hair could be telling you something's going on. For example, if you're losing clumps, maybe you have an autoimmune disorder that's been misdiagnosed or missed. So use your hair as a biomarker. Now follow us, you guys, too. If you can't get to a trichologist, follow us on the Hairwire, because we're constantly putting up great videos. You can also listen to us as a podcast as well. We're sharing information on the different types of hair loss and even what to look for if you're struggling with any of the conditions that I just talked about, for you to help find you and kind of pinpoint what's going on, so that way you could reach the right people for you. Now, make sure.
Do you know, Carrie, what is the condition that's when we have pain in our scalp, like pain in our hair follicles?
I do.
Let's talk about it next episode.
Yes, let's do it. All right, you guys. Thank you for following us. Follow the Hairwire, thehairwire.com, to get hair smart. Bye for now.
Hair smart.